Diabetes is a chronic disorder whereby the hormone insulin is either not effective or is not produced enough. The insulin is usually produced in the pancreas, and in some people, when the production is low or reduced, we get into a situation where the blood glucose goes up because the insulin hormone is what is required to manage our blood glucose. So when we get into a situation of high blood glucose or hyperglycemia, this can lead to many complications, such as especially in our nerves as well as our blood vessels, and this then leads to damage to kidneys, heart and various organs in our body. The other important thing to know is a person with diabetes has a 3 to 4 times higher risk of getting heart problems or heart attacks and strokes more than the general population. Diabetes also leads to multiple risks for the person's legs with foot ulcers and a possibility of amputation. It all sounds very scary when someone has diabetes with all these implications. However, it's also important to know diabetes is also a disease which can be prevented, and we'll talk more about this. So diabetes is as common as it is, its symptoms are actually very few and far between. Many people actually don't realize when they have diabetes because the symptoms are very minor. But classically, there are 3 very common symptoms that are seen when someone's blood sugar is high for some time. These 3 symptoms are excessive thirst, excessive urination, as well as unprovoked weight loss, meaning weight loss without trying. So these classic triad of symptoms are commonly seen among people who have uncontrolled blood sugar. However, let me remind you again, symptoms are not always seen, and the commonest way that we find out somebody is diabetic is when they undergo a general health check. So a person with diabetes requires not just a doctor to look after him, he requires a team. So in Durdans, we have the team. So the team are, of course, it involves a physician or a specialist and a dietitian to discuss all the implications of food. And this is a very important part of treating diabetes, and every person with diabetes should see a dietitian. In Durdans, we also have the diabetes educators who are nurses who are specially trained to help the patient maneuver through all the problems and needs of a diabetic. For example, how to monitor their blood sugar, how to use a glucometer, how to look after their feet, for example. So these are the things that we have in Durdans, along with all the specialists that are required to manage a diabetic, for example, an endocrinologist, a physician, an eye surgeon, a kidney specialist and heart specialist.